name is David Little, and I am in private practice in San Antonio, Texas. I also serve as an adjunct clinical professor at the University of Texas Health Science Center Dental School in San Antonio. There's many different types of trays out there. The most important thing is to make sure that it's not impinging anywhere and you can get and replicate their bite with it in their mouth. I prefer to do this before anesthetic because that way I can mark where their occlusion is and visualize that so that when I put them back into the impression, I know that I'm getting the proper bite recorded. It is very important to have your assistant load the tray simultaneously as you are syringing around the tube. But one important thing is that it's very, very critical that the tray is not underfilled. If you underfill a tray and don't capture all the detail, then you're going to have a remake and not a good situation. So I always advise my assistants to overfill the tray, because if you overfill it, worst case is you use too much material, but you'll still capture the detail that you want to capture. This rigid material, that by the Take One material, Kerr's Take One material, is one of the biggest benefits of using this material. It has a very rigid set, which really helps in the lack of distortion and the accuracy of your impression. So this step is very critical to the success of the restoration. In placing the Take One light body material, again, I like to start in the interproximal area and slowly syringe around, keeping the tip in the sulcus all the way around, moving slowly. And it's also important that you keep the tip in the impression material so that you don't incorporate air. And you notice I'm very liberal with my material. Again, I'd rather have more material than less, and you can see I'm syringing it all the way around, timing it with my assistant, getting ready to place the tray. So now, once I seat the rigid, and my rule is whoever seats the tray stays with the tray. So I want to ensure that the patient is biting properly, and I want to hold that patient in position, and I don't want to transfer that to the assistant. I want to make sure I stay there and make sure that that happens. Always verify that the material is set, then remove the tray, and you'll see because of the rigid material it's going to fit well. You'll have to snap it out, and then the first thing you're going to want to do is to check for the accuracy of the impression. And you can see we're looking at the preparation, but also the teeth around it as well. It's important to inspect the impression thoroughly. Make sure that you've captured all the detail you need on the preparation and also the teeth on either side, the adjacent teeth and also the opposing teeth, and make sure your bite is where it needs to be, because it's much easier to take a new impression at that time while the patient's still seated than to have a bad impression, have to come back for a remake. So you really want to make sure that you do that. But if you follow the steps like we've talked about, you're going to get a very consistent, very accurate result. As you can see, with the close-up in the middle, the accuracy, and that leads to an accurate die, which in turn leads to a very nice definitive restoration. As you can see in these smile photographs of the final restoration, the impression is the foundation for quality restorations. And that's why we've spent this time to see the importance of the restoration. And the dual arch technique is a very predictable, very accurate technique as long as you take the steps to do it correctly. I think there's a huge advantage of using the rigid tray material. It gives the tray stability and also helps for a more accurate impression in conjunction with the Take One light body material.